Hello everyone. Let's learn about symptom management. Symptom control: respiratory, breathlessness, cough, terminal respiratory congestion; gastrointestinal, nausea and vomiting; antiemetics, bowel obstruction, constipation, laxatives. Symptom control: constitutional, anorexia, weight loss, weakness and fatigue; neurological, acute confusion and delirium, terminal restlessness; breathlessness or dyspnea. One of the most distressing and common symptoms of a patient with a life-limiting illness is breathlessness, and it may feature in 70% of patients in the last few weeks of life. Patients may describe it as, "It feels like I'm going to take my last breath. It feels like I'm suffocating and it's very frightening." Breathlessness: supporting your patient. Help the person to find a more comfortable position. Use a fan. Make sure that there is adequate room ventilation. Try not to ask questions that require long answers. Use closed questions. Aromatherapy may help. Breathing exercises will need to involve a physiotherapist. Medication may be prescribed to help. Comorbidities: often patients will have more than one chronic condition which may complicate the assessment process. However, as the person declines, ongoing assessment is imperative to manage the transition from managing the condition and maintaining well-being to managing the dying phase. For example, someone who has lived for many years with chronic obstructive pulmonary disease and heart failure is at risk of having a very difficult time in the last few days of life by being exposed to inappropriate medical interventions that will not be of any benefit to them. It is beneficial for the different teams involved in the patient's care to communicate with each other and use prognostic indicator tools to support advanced care planning. Comorbidities: breathlessness or dyspnea is the unpleasant awareness of difficulty in breathing. Dyspnea, like pain, is subjective and involves both the perception of breathlessness and the reaction of the patient to it. Dyspnea is always associated with some degree of anxiety, which in the turn will make the breathlessness worse. Causes: airway obstruction, tracheal, tumor, tracheoesophageal fistula; bronchial, tumor, chronic bronchitis, acute infection, bronchitis, bronchospasm, bronchitis, asthma. Causes: reduction in functional lung tissue, surgical resection, tumor, fibrosis, pre-existing, radiation, pleural effusion, infection, hemorrhage, pulmonary embolism, chronic obstructive pulmonary disease. Causes: impaired ventilatory movement, chest wall weakness, motor impairment, general debility, chest wall pain, elevated diaphragm, cardiovascular, congestive cardiac failure, pericardial infusion, shock, hemorrhage, septicemia, anemia, anxiety. Assessment: clinical history and examination together with knowledge about pre-existing edema disease are usually sufficient to determine the cause of dyspnea. Whether investigation should be performed looking for a reversible cause depends on what stage the patient is at on the terminal illness trajectory, their identified goals of care. Thank you, my friends.